LensbergEnterprises.com.
Many patients with depression are reluctant to take psychiatric medications. Hence, complementary therapies such as nutritional considerations could be advantageous. The antidepressant potential of olive oil has been proved in observational studies. The effect of extra virgin olive oil on depression symptoms and cortisol and brain-derived neurotrophic factor levels in patients with depression was examined. This was a double-blind randomized controlled trial conducted on 73 patients suffering from major depressive disorder in Shiraz, Iran, in 2016. The patients were randomly assigned to intervention group who consumed extra virgin olive oil, and a control group who consumed sunflower oil, 25 milliliters per day of the corresponding oil for 52 days. Depression symptoms were assessed by Beck Depression Inventory 2 and 7-item Hamilton Depression Rating Scale. Salivary cortisol levels were determined immediately after awakening and 30 minutes later. Cortisol awakening response and the area under the curve with respect to ground and increase were computed. Serum BDNF concentrations were also measured. Statistical analyses performed. Statistical analysis was conducted based on intention to treat and per protocol approaches. Within group changes were examined with repeated measures, for BDI2 and HAM7, and with paired t-test, for other variables. Between group comparisons were performed with analysis of covariance after adjustment for confounding factors. In intention to treat analysis, HAM7 score was the only variable with significant changes within and between groups, the latter as a greater decline in extra virgin olive oil group. BDI2 score did not show significant change in either group, but the between group comparison revealed a significant difference. Extra virgin olive oil showed antidepressant effect in severely depressed patients but not in mild/moderate depression category. Serum BDNF concentrations, salivary cortisol levels at immediately after awakening and 30 minutes later, cortisol awakening response, the area under the curve with respect to ground and increase did not change within or between groups. Results of per-protocol analysis were not different. The results of the study suggested beneficial effects of extra virgin olive oil on depression symptoms in patients with severe depression but not in those with mild to moderate depression. The effects were significant from both statistical and clinical points of view. Scientific evidence can be found at the link below.